Many genetic and environmental factors can cause tumours to form. For instance, UV radiation from the sun can damage DNA and other structures in melanocytes, which are the pigment-producing cells in the skin. Chronic damage to melanocytes by UV radiation leads to most cases of melanoma, which is a type of skin cancer. As melanomas grow, they can eventually spread to other sites in the body, such as the lungs and liver. The cells of the immune system are continuously monitoring our tissues. Natural killer cells, or NK cells, sense stress-associated molecules on damaged and cancerous cells. Dendritic cells, or DCs, activate cytotoxic T cells, which can then sense tumour-associated antigens using their T cell receptor and other co-receptors. Once activated, NK cells and cytotoxic T cells release perforin and granzymes. These molecules punch holes in the surface of the tumour cells, causing them to die by apoptosis.